Clinical cases. Case 10 describes BondBone used by itself in a sinus lift, although we encourage using a composite graft for sinus augmentations. In order to support the sinus lining from collapse, 2 implants were placed simultaneously. The radiograph image presents a complete bone regeneration and is obtained 5 months post-implantation. The trabecular form achieved is similar to the one exhibited by the hosting bone. Case 11 describes the use of BondBone after a failure of 2 implants. 2 voids remained after implant removal. Each void conforms to the indication of using BondBone by itself. However, since we have 2 adjacent voids, we need a longer space maintainer. Thus, we would usually encourage using BondBone as a composite graft. In this particular case, since we wanted 100% natural bone regeneration, we used BondBone in the following way. We filled the voids using BondBone by itself and used granules above as a barrier in order to prolong the resorption of BondBone. The following describes the use of BondBone in bone guiding techniques. A first BondBone layer is used in direct contact with the bone to gain a complete regeneration. Granules serve as a membrane in the outer layer in order to postpone resorption of BondBone at the periosteal side. 3 months post-procedure, a complete regeneration of the defects is obtained. Remnants of the granules in the outer surface can still be seen. Drilling in the regenerated bone allows implant placement. Case 12. BondBone can be very useful in a bleeding area. In this case, soft tissue was grafted from the palate area and the bleeding stopped immediately by applying BondBone above the area while pressing against it. Case 13 presents abundant arterial bleeding in the mandibular jaw. Bleeding stops instantly by applying BondBone and pressing it against the bleeding area. Eventually, excellent augmentation is achieved. We gain 2 birds in 1 shot. 3 months post-procedure, radiograph reveals uneventful complete regeneration. Complete regeneration was confirmed during re-entry. The next video presents using BondBone to stop arterial bleeding. 3 months post-procedure, we witness an outstanding healing of both the soft and the hard tissues. If it's so impressive, do we need the other bone graft materials? The answer is yes, since a variety of clinical cases require augmentation materials with longer space-maintaining capabilities. However, when using granules alone, they dramatically limit the quantity and quality of the new formed bone. Thus, in order to obtain higher percentage of newly formed bone, we encourage using BondBone as a composite graft. BondBone has the ability to encourage larger quality and quantity of newly formed bone when used as a composite graft. The following illustration describes a bone filled with granules in about 80% of the volume. The maximal amount of new formed bone in that case is 20%. Since bone can be formed only within the gaps between the granules. In that case, it will take 6 to 9 months for the structure to be stable enough for re-entry. When BondBone is used as a composite graft, it occupies about 70%, and the granule occupy about 30% of the volume. BondBone resorbs simultaneously with the formation of bone, thus the maximal amount of new formed is 70% of the volume. Therefore, new bone of high quality and quantity is formed. In most cases, it will take 3 months for the structure to be stable enough for re-entry.